Get to business.
Did you say the business?
But your camera isn't working.
I'm going to mute everybody.
Okay, we're going to mute everybody. You'll have to unmute yourself to say anything. And of course, if you would please, when you start talking, to make a motion or ask questions or anything that's going to happen, say your name first and then state your business. Okay, who all do we have here? I'm looking for Brian Dodd.
Here.
David Dunn. Wallace Dunn.
Wallace is here, and I heard David speaking earlier.
Okay. Ben Quiros.
Here.
Mary Lou. I think she's just muted. Are you there, Mary?
She doesn't know how to unmute it.
Richard. Richard's not with us yet? Richard's.
Yeah, he's there.
He's here.
Oh, yeah, no, I'm here.
And Don Hallmark. I'm here. Is that everybody? Okay. So let's call us to order. Let's start off with an invocation. I can assure you that we need to call in our Lord and Savior to get this started. Russell, would you do that for us, please?
Let's pray. Lord above, we thank you for today. We thank you for this time together, Lord, that you put us here and you put us in this spot today because you've got a plan. And we rely on your plan and we trust you. We ask your blessings on our patients and those we serve. And Lord, we ask your protection on all our frontline workers, our nurses, doctors, housekeepers, police, fire, and that you protect them, Lord. Bless our families. And please forgive us for your failures. In your name we pray. Amen.
Amen. Thank you very much. I'd like to read our mission, vision, and values. Our mission: Medical Center Health System is a community-based teaching organization dedicated to providing high-quality and affordable health care to improve the health and wellness of all residents of the Permian Basin. And our vision: Medical Center Hospital System will be the premier source for health and wellness. And our values: integrity, customer-centered, accountability, respect, and excellence. That stands I care. Okay. Conflict of interest disclosure by any board member. If any board member has any reason to disclose a conflict of interest, please make that known now. I wonder, yeah, Mr. Landgraf is there. Hi, Mr. Landgraf, how are you? Have you got a legislative update for us?
Happy to do it.
Good to hear you.
Well, good. Are y'all ready for, and I'll be on here for the whole meeting if y'all want to wait, or if this is where I am in the agenda, I'm fine, but whatever works for y'all.
That's where we got you.
All right. Well, good. Well, I appreciate y'all making some time for me, and I think we had this scheduled before the world kind of changed on us a couple of months ago, and so my original purpose was just to check in with y'all as I like to do during the years when the legislature is not in session, and just to see if there's anything that I need to be working on. I know that we're always looking at ways to improve the Ector County Hospital District's enabling statute and looking to see if there are any amendments that need to be made so that y'all can make the district work better for patients, for the staff, and for the taxpayers. And so I just wanted to check in on that front. Of course, the legislature won't be in session until January of 2021, so we have plenty of time, and I know that that's probably not what's on everybody's agenda right now, but of course I'm happy to come back, but I just wanted to make sure that y'all are aware that if there is anything that I can work on that front, just please let me know. This is what I'm here to do. But in the meantime, I did just want to compliment you all and Russell and really everybody on the medical staff, everybody in housekeeping, all the way up to the medical professionals. I just, y'all have done everything that has been asked of you in the last couple of months, and obviously before that. But we've been, we've unfortunately seen crisis after crisis, and medical center health system has been right in the middle of that, which for going on a year now. And anyway, the response from the hospital has been magnificent at every step. And I'm not just talking about COVID-19. I'm talking about going back to August 31st. And anyway, I know that those things don't happen by accident. There's some divine guidance there, but you also have to have the right people in the right place at the right time. And y'all have managed to do that very well. And I just want to let you know, as a taxpayer in Ector County, I appreciate that, because y'all have been a real source of pride for all of us. Now, having said that, I know that the state of Texas has put y'all in a tough spot financially, and I've spoken with some of you on the board about that, and I've had very extensive conversations with the chief executive officer about the financial strain that some state actions have had, not only on the hospital district and the operations at the hospital, but unfortunately, this is having a big impact on every public hospital and every private hospital across the state of Texas. But it's something that we have to be acutely aware of, because this recovery is going to be different for us in the Permian Basin than it is for other parts of the state, just because of our tax base. And I don't think I have to go into any details about that. But I guess this is all a long way of saying that we are going to have our work cut out for us. Y'all done your job, and now it's my turn to do my job, to do everything that I can to help you, because whatever mess is coming, it wasn't a mess that y'all created. It's a mess that was created for you by a government in Austin. And, right, wrong, or indifferent about how that all happened, I'm going to do everything that I can to help you. So just know that I'm sensitive to those concerns. I think we have an idea of what's coming, and I want to do everything I can to mitigate those problems. But I've been talking too long. I just wanted to let you know those two things. But also, if y'all have any questions for me, if it's okay, I'd be happy to answer those if we have time, and if there are already questions. And it can be about what we've talked about, the upcoming legislative session, or anything in between.
Look, this is Don Hallmark. I just wanted to say to you that not just this hospital, but we know like Alpine filed bankruptcy last week, and that's just the first of many to come, I'm sure. And I know that the state can't answer to all of that. There's not enough money.
Right.
Enough money anywhere to fix all of this. It's going to be tough, but I feel like that we're going to have to find ways to go outside of just government relief to find money. And we're here. I'm here. I'll do anything we can do. I'm racking my brain. We've been talking about these things. So just know that we're here to do anything that's necessary. We've got to find a way to solve some of these problems. We can't, rural America can't do without hospitals.
Don, I appreciate that very much. And I think you're absolutely, a key takeaway from your comment there, I think you're absolutely spot on, is that, the cure that we're going to be looking for, I think the government needs to kind of make right on this, and I'm talking about at the federal and state level.
Right.
But I think we're going to have to find some other solutions outside of, just looking to the government, because, as we all know, that just ends up putting the burden back on the taxpayers, which is who the burden's been on this whole time, anyway. So, we can shift around some of these different pots of money, but it would all end up the same way. So I think, to your point, we do have to find some ways to unleash, some more, some free market solutions that maybe have been restricted before, so that we can allow the professionals to do what they do best and allow people to get the care that they need. Now, I'm not worried about medical center, not surviving this. It's a matter of how painful it's going to be and for how long before things are back, to a relative normal. But I am, worried about Big Bend Regional and, some of the other smaller hospitals in the 4 counties that I serve, that we're kind of struggling with their census numbers even before this began, and then, have certainly taken an even harder hit since then. And yeah, as y'all know, if these hospitals, particularly in these smaller markets, aren't, if they're not growing, then you're effectively kind of dying on the vine, and that's not good for those communities, but also that will have another negative impact on Ector County, because as you know, that the fact that a hospital goes away doesn't mean that healthcare needs go away. It just means that they get shifted. And so medical center in a lot of these cases would be tasked with kind of absorbing those healthcare obligations. But as you know, and I know, that tax base doesn't expand along with that. So you really have more responsibility without any of the financial benefit that comes with that, at least from a tax base perspective. So it's better if everybody can survive and if everybody's unleashed to be able to do what they do best. And so I think that has to be the heart of any solution that we find.
Well, thank you for that. I know that this board is extremely diverse and willing and ready, and I'm just proud to be a part of this system and these doctors that have done what they've done, and our chief and our administration bringing all of the hospitals together, ORMC, and working with the county, and it's just been an amazing thing to get to see, and I'm thrilled to be a part of it. But we're there, and we're ready to help with anything you need us for.
Well, Don, it's going to be a team effort, and I look forward to working with you and everybody else on the board and the other hospitals in the region, because it's going to be an all hands on deck situation. But I'm looking forward to being a part of it.
Me too. We thank you.
Brooks, this
Yes,
is
sir.
Russell.
Thank you.
Brooks, this is Russell. Can you hear me?
I can hear you, Russell.
I just want to tell you, thank you, man. I know you and I have had a lot of evening and late night conversations, and we even got to share a conversation with your young daughter, and I hope we didn't get her too far into politics already. But I just want to tell you, I appreciate you always taking my call, and if nothing else, just to be an ear on the other end of the line. I just want you to know I really appreciate that and your time, and we appreciate you being our rep and what you do for us. Thank you very much.
Well, Russell, you're very kind to say that. My only regret in all of this is that, having my daughter close to my side, she'll be 5 years old next month, and she was proudly born at medical center in the Center for Women and Infants. But yeah, my only regret in all of this is that she's been hanging around you too much, and now I'm afraid she's going to go off and make a mistake and try to be a hospital administrator or something. I'll get her talked out of it, though. Don't worry.
We'll pray for her.
Yeah.
Brooks, we appreciate you, sir. We thank you for all you do.
Well, I appreciate y'all very much, and I'll check in, and I'm available anytime. But I'm here to serve, and y'all know this. I mean, we've been around, a few of these corners together already. But I can do a better job for y'all when I know exactly what y'all need. So we're still kind of in a crisis situation right now. But as that abates, just know that I'm always a phone call away, or I'll be happy to sit down, when it's safe to do that, or just hop on the phone. But I feel more confident in my abilities as a state representative when I'm in direct communication with y'all. So anyway, just know that I'm always here for you, and I'm here to serve, just like y'all are here to serve not only the hospital but everybody in Ector County. And I do appreciate the work that y'all do. I know you don't always get all the it's a thankless job sometimes, but what you do is very important, and I appreciate it. And deep down, a lot of people in our community and across the county do, even if they don't say it as much as they should. So anyway, y'all keep up the good work. If there's anything I can do for you, please let me know. And if Russell, if you don't mind making sure everybody has my contact information, just feel free to share my cell phone number with everybody so they have it.
Thank you.
Thank you, sir.
you.
All right, y'all take care.
Found that button. Okay, so next we're gonna go to public comments on agenda items. I would like to remind anybody that has any comments for anything that before you speak, we're gonna need for you to state your name, your address, your specific agenda item to be addressed. And
You got 3 minutes.
we'll give you up to 3 minutes. So if we've got anybody that's there that would like to say anything, it's your turn. So if I don't have anything, I'm going to go ahead with the consent agenda. Have you guys looked over the consent agenda? I have. I will entertain a motion.
I make a motion for approval. This is David.
In a second.
Wallace Dunn will second.
Have a motion and a second. All in favor say aye.
We need to do roll call.
Oh, wait a minute.
Aye.
Hang on just a minute. We got to do a roll call. I knew better. I just dreamed.
Come on, Don.
All right, let's do a roll call vote on this. Brenda Dodd. David Dunham.
Aye.
Don Hallmark Guy. Ben Kiros. Richard.
They have to unmute themselves.
You got to unmute your buttons, folks. If you don't know where it is, then let us help you. Oh. Brand texted aye.
Can you put their picture on there so we can see them? Raise their hand.
When they speak.
Brent said she can't unmute.
Yeah. We got that. You can't unmute them all?
Mm-mm.
Let us work on that second, folks.
Call me, Don. I'm unmuted.
I know.
I vote aye. Wallace Dunn.
How about me, Don?
I got Mary. All right, Mary's, what's your vote, Mary?
I approve.
Aye, okay.
Hey, Richard said he couldn't unmute either.
Ben must not can either. I can see you, Mary.
We
Thank
see
you.
Mary. Get off the camera.
Well, Richard's emailing me for some reason.
He said he couldn't unmute.
Try
Yeah.
*6.
Try *6.
They hovered over.
Hang on, folks. We're gonna get this fixed or figure it out.
Mary Lou, you did get off the camera. You're muted again.
Don't leave, Richard.
He just left.
Uh-oh. I see Flicker.
What are we looking at there, Mary Lou? Oh, let's look at.
If you hover on the screen, you should have a little taskbar that has the camera and the mute button.
You guys see that? If you hover over the screen, you should get this bar that shows.
Share your screen.
Okay, which way to do this?
Hey, mine just started working, but it says administrator blocking camera and
I see you.
Well, we see you laying on your couch.
yeah, I didn't see the beard, did y'all?
Uh-oh.
Richard, you do have pants on, don't you?
No, sir.
Don't stand up.
Everything's going nuts on here now.
I know. Well, I think,
Can you see my screen?
can y'all see the screen here?
Yeah, I was at the very bottom over here.
Yes.
Don't hang up.
Yeah, there's a mute and unmute.
Yeah.
Bryn, have you tried that again?
I told her to log out and log back in.
Okay. Bryn's back in, so we'll wait a second.
I approve.
Oh,
Yay!
Hi, Bryn.
I even tried to make the motion.
All right, Ben, we're gonna try you. Can you unmute his on Ben?
No, we can't unmute anybody. They
Oh.
have to unmute
it shows
themselves.
you muted.
Oh, yeah.
Unmute your own.
So Jen, he might have to hit the three dots here. I don't know if you can see my screen.
Ben, you might have to hit these three dots right there for more actions.
Hello, can you hear me now?
Hey, hi, Ben.
Yeah, we got you, Ben.
All right, approved.
Okay.
I can.
Yes. Richard's a yes. Wallace a yes. David's a yes. Bryn's a yes. And Mary Lou's a yes. I'm a yes. We're all yes. Approved. Okay. Committee reports. First, we have the Finance Committee. Ms. Bryn,
Can y'all hear me?
I can hear you.
Ooh, okay. The Finance Committee met today at 5 o'clock. I'm used to saying 4:30. 5 o'clock.
We see you now.
We met at 5 o'clock today, and we reviewed with Mr. Charlie Brown the quarterly investment report for quarter 2, and Mr. Ewing reviewed the financial report for month ended March 31st, 2020, and we also approved the quarterly investment officers certification, and I would move to approve the Finance Committee report.
David,
second.
seconds.
Have David done as a second. I'll take a roll call vote. Bryn,
Aye.
David Dunn,
Aye.
Don Hallmark, aye. Ben Kiros,
Aye.
Richard,
Aye.
Mary Lou,
Aye.
Wallace.
Aye.
Okay, hey, we're moving right along. Next, we go to our CEO reports and actions. Mr. Tippin.
First one, we have we have a Telecare presentation, and we're going to attempt to take over your screen briefly. Hopefully we'll get you all back, but Mason and Mallory are here to give you a quick update on Telecare. And Mason, take it away.
Absolutely. Well, Mr. Chairman, Mr. Tippin, thank you all for having both Mallory and I here today to talk a little bit about MCHS Telecare, which is our kind of our new telehealth platform that we'll hope to roll out here in the next about 8 days. So without further ado, I'll get going here. So again, this is kind of just our title slide. So I'm the current program owner, kind of project manager of this project. Here in about 10 days now, I'll be handing this off to Mallory. I think with her experience in the region, as well as her connections out, working in those 19 counties and beyond, I think she'll be a great program owner of this really new service line. Our executive owner is going to be Tony Land, kind of a co-executive owner with Linda Carpenter as well. So we have the patient experience, nursing side, as well as the technical side. So a little bit about the vendor that we chose. So this started approximately 10 months ago with Dr. Nabolsi and myself. We're vetting different vendors where we're looking at direct-to-consumer models. So what that means is we live on your phone. So there's an application that lives on your phone, whether it be an iPhone or Android, as well as an option for a desktop application via a web browser. So at this point, you have a 24/7, 365-day access to healthcare, whether it be provider of your choice. So again, Teladoc is the vendor that we chose. I'll just wait one quick second for Miss Jan. Yeah, music. So Miss Jan, if you want to start playing that video there. So Mallory picked the music here. So for those that can actually see the screen, this is a quick 2.5-minute video of kind of end-to-end user content. So end-to-end user content, patient logged in, provider will be taking it, and then send it. So while we'll go through the video, I'll time this application, yeah, 736. Everything right within.
Hello? Hello?
After that, what's down the road?
Hello? Excuse me?
Not in the
Hang on just a second. We have somebody hollering in. If you'll hang on just a second, we'll get to you.
So, like a better word, sometimes non-benefit.
Hello? Hello, we're trying to be part of the meeting.
I can.
Can
hear
you acknowledge?
I can hear you, but right now is not a good time for you to be a part of the meeting.
Well, we were in on the public comment. You just wouldn't recognize us.
Okay, well, if you'll just hang on, we'll get to you.
We have
Go
been, are you on the public?
Ma'am,
Okay,
you need
what
to
do we
wait-
do?
You need to wait your turn. If you'll hang on, we'll get to you when it's your turn.
Oh, you'll get to it. Okay, thank you.
Well, this application is great because, and that's what you've given load going on right now. All of our full employees are benefit plan. So, as it goes wrapping up, go to the next slide here. Yeah. So again, the process of the flow of this is continue polling. And right now, I'm in the well position that in 3-4 months' time, we will on for our care provider. We'll be merged with the app currently using. And this is just an education piece to not only. This is a really exciting time for telehealth. This is the white label marketed web browser. See here, it's just a snapshot. So again, everything is marketed towards us. It works. Everything works back towards. The last thing I'd like to touch on is just our 3-year phase-out strategies. So this is a 3-year contract. This is a self-funded project. Other allocated funds from the implementation of health. So again, we're rolling out our voice first, non-benefit information, and then to health. We hope that down the road, COVID-19 guided this time. We hope to own specialty clinics, so you're attention. The last stage of the strategy is so you can kind of lock it all that side. We're driving out. Mallory, can you comment for pyramid?
We have some of this working right now. And, I think we've expedited way faster, 18 actually.
Yes.
Thought it's kind of been the savior of things. So you think that the COVID has changed how we use it? I mean, to me, the way I see it, I actually had a doctor tell me, this makes all the sense in the world for somebody. Right? I don't need it. complete and like it is now.
If you can hear us, can you tell us if you can hear us online, please?
Hello?
Anybody hear us?
I can hear you, but it's very bad quality audio.
I can't hear anything.
Okay, hang on a second. Okay, can y'all hear us? Anybody say something?
I can now.
All right, David, thanks. Brenda, you there?
I can hear
Okay.
you now. Thank you.
All right, did y'all hear the presentation?
Not a word.
No?
Did you see the slides?
Yes, I
We
saw
saw
the
the
slide.
slides.
Well, yeah, that's some of Mason's best work ever. He didn't.
Mason owes me an explanation in the future.
Yes, ma'am. I'd be happy to walk you through it at some point.
Well, you better get to him today because unfortunately, this is his last board meeting with us. He has taken another position closer to his fiance. We're not sure what that's all about, but this will be Mason's last board meeting with us. And so Mason, thank you for what you've done. We appreciate, I know I appreciate the relationship we have, and we wish you the best in the future. And thank you for getting this ready for Mallory and getting this launched out. But we truly appreciate your efforts and what you've been able to accomplish here while you've been at Medical Center. So thank you.
Thank you, Mr. Tippin. Appreciate it.
Anybody?
Good luck.
It's okay. For those of you who didn't hear, my name's Mallory. Yes, Mason has done a wonderful job and really just turning this into a great opportunity for Medical Center. Like he said, it's a new service line for us. We're super excited to bring this not only to our employees, but to the region eventually. I think that this is going to be a great opportunity for the region to seek that specialty care like they should be able to. So we're just very excited. We're hoping to get some good feedback as we're going to roll this out to the employees so that we can correct any kinks and just really roll it out to its full effectiveness come in the next few months. Is there any questions?
You know, this is Richard Herrera, District 3. One of the things that we've been looking at, and I've had some questions from people in my area, is I know that we're going to see some financial difficulties coming up here in the future. Their question is what are we doing to generate more income through stuff like telemed and so on and so forth, where the elderly aren't going to be able to get out and come to the hospital as easy as it used to be because of the virus, you know, and it's going to probably be something that will be very detrimental to us in the future, is that telemed is going to be something that will be a little easier once generations like mine get up and have a little bit more confidence in using technology. So I know you said we're going to try to get this out. How are we going to try to do that?
So there is several phases to this rollout. We are first rolling out to MCH benefited employees, including our recent furloughed employees. The next phase that we're anticipating is in July, and that'll be us onboarding our primary care physicians. The next phase will be rolling out to the community within, what did we put on the time frame on that?
Fall 2020.
Fall 2020, and then the specialties will be onboarded last, and then we'll roll out to the region. So again, within an 18-month time frame is what we're anticipating the whole total project. I think COVID definitely put a rush on this, or just really just a different perspective. We've seen a lot more physician buy-in and just really just the community in general. So,
Richard, this is Russell. One thing that's very interesting is the reimbursement rates for virtual visits have really started to line up with face-to-face rural clinic visits. And so we already have some of this deployed in some of our physician clinics where they're doing this because the federal government has relaxed some of the guidelines, which has really made it nice for some of these, just like you stated, these elderly folks that are maybe too scared to get out or just physically can't get out, that we can get right on there with them and get their med refills and do a face-to-face update with these. So, so Mason and Mallory have really got us in a good spot to get this launched. And I think your answer to your constituents there are that the technology that we have have got this ready to deploy, and this will be rolled out to the public very soon on a more broad scale.
Russell, what we were discussing, it just, with us being all home and stuff, our neighbors look over the fence more than they used to. So we just happened to start talking about getting in to the hospital. Some of them have appointments, and some of them have started to actually use telemed to see their doctors. And they said, why doesn't MCH offer something like that? And I said, I believe that's something that we're working on. And another suggestion is some of the nurses that we have that are available, that were sent home, or some of the other clinical people that, we don't need right now. Some places are using them to actually take laptops or communication devices out to patients and set it up for them where they can have a clinical visit, if they do not have technology available.
Yes, sir. That's on the clinical visit on the technology side. What we're having to really pay attention there is what the CDC recommendation is about deploying into a patient's home right now, especially the elderly and the immune compromised patients. Just because how fast this thing is moving, that we are really watching the guidance on that to be able to deploy people into the homes. But I think your immediate answer, Richard, I think you kind of touched on it, is it is available, it is in use right now, and that platform it's on will only be expanding in the future to the general public.
Thank you.
Okay, anything else from anybody? Okay, so look, let me just tell you, we've got something going on with this computer. It's going to try to turn off in 13 minutes or 12 and a half minutes. So I don't know what that's going to mean for us. If it does, hold tight. We'll get a hold of everybody and we'll just have to restart. Okay. Any other questions on the Telecare presentation? Okay, next up is consider approval of transfer service, and if there's anybody online that wanted to talk and wasn't in, you need to first give me your name, your address, and the specific agenda item that you're addressing. Is there anybody that would like to speak at this time?
I think Carol Arango was on the call trying to say something, but I don't see her.
She was on there a while ago, but
you
told her to wait, and now I'm not hearing anything.
Hold on one sec. Let's see if I can find.
Somebody unmuted the 704 area.
I'm worried that they're not able to unmute or something, because I think that's what happened earlier.
We have this one right here.
Who has a phone number of 704-965-1674? If you have that phone number and you're calling in, it shows that you're not muted and there's some noise generated. Anybody by that number on there? Anybody else? Anybody got anything to say?
Well, I think I want to kind of make a couple of comments about the transport deal there. But so I've been thinking about all of the, this ambulance transport thing over the last couple of weeks, and man, I've just learned a lot. And I don't know. I mean, I was just I want to keep things local, but I mean, we aren't the experts on that, and I've expressed those concerns. But I mean, I'd still like to hear from I guess our administration, from Kristen and maybe Russell. Is that still the direction that that y'all are wanting to move?
I would like, before we get into that, I'd like to say that I don't like the fact that we're calling the service that's been with us for over 10 years not local. They're here. I know they don't have a bus here, but they're one of the biggest ambulance companies in the country. They can get a bus to us pretty quick. So I don't see how they're not local. That's just my point. And I understand what you're saying, Ben, but that's my comment to what you're saying. Go ahead, Russell.
Yes, I'll be happy to address this, and if we lose this connection, we will quickly get back on. So we are seeing this countdown for an automatic reboot. I think that's a complete system-wide in the whole hospital. So just stand by should we lose you. One thing I want to talk about on this transfer is that we had to really have some serious conversation about this. As some of y'all may remember, this was a situation that was first addressed back in 2017 with just making sure that, number one, that we were doing what was best for the patient of Medical Center Hospital. And the patient care and the patient safety, it is our job to ensure that we are providing the highest level of care we can when we ship somebody to the next place. And that falls on us to ensure that that happens. Is everybody still with me?
I am.
Okay.
Okay. I just want to make sure.
I am too.
Okay. That being said.
Me too.
Thank you. This subject was, again, worked on several years ago and kind of came to a standstill. And then over the period of time with different administrative staff, it kind of fell to the wayside. And now here we are, and it's still an issue that we have got to get this handled. We have had a very level playing field for all the parties involved, sending out the request, having multiple meetings with vendors, local and unlocal vendors. And I tend to agree somewhat with what the chairman said. This is not a new company to us. They have been in the air ambulance service in Ector County for over 15 years, probably 18 years. And they have done a good job with that. Not to say that a local vendor is not performing at that, but this is a safety issue and a taxpayer issue. When I say the taxpayer issue, what I can tell you is that this contract is a zero cost contract to the citizens of Ector County through the hospital district. That the hospital district is not anybody's guarantor. We are not subsidizing this company, that this is a zero contract. They are at risk, which currently our current situation with all the other providers is not as such. That if we have a patient that is not able to pay, or that the local companies cannot collect from, those companies bill Medical Center for that. So far this year, that has cost the taxpayer over $200,000 in supplemental funding to these other EMS companies. And in fact, that does not count the times that we have had to call to the local companies. They're unable to respond. We're having to fly these people. And because the way the agreement is now, Medical Center is currently responsible for the flight as well. So the 200,000 plus is only to the locals. That does not include the flight transportation. Under this new agreement, there is, all that is taken care of. And so that does provide safe care for the patient and a relief through the subsidizing of the local companies. So with that being said.
Can you hear me now?
Yeah, who is this? Who is this?
This is Carol Uranga.
Okay,
This is Carol Uranga.
Carol, I need your name, address, and your specific agenda item to be addressed. Carol, let me say something right quick. We've got 5 minutes and this computer is fixing to.
We're going to swap it out here.
You want to go ahead and do it now?
I understand fully. I understand fully.
Okay.
But I think that what I want to ask is that.
Carol, I need your name, address, and agenda item.
My name is Carol Uranga. My address is 10742 East Emerson, Gardendale, Texas. And the agenda item is a transfer, the transfer contract that has been addressed right now.
Okay, you got 3 minutes, Carol.
Yes, sir. I wanted to have my general manager, my manager of operations, talk with you because he's a lot more professional. But I think that number one, Russell, we have not met consistently. Number two, we have not received their vote. Number three, you're given the contract to AeroCare. Their license is air only. They're going to add AMR, and I understand they're already in contract with each other, but nothing that they can do can be better than what we're doing. When you're quoting numbers and money, then what you need to look at is that they cannot do it any less than we can less money than what we're doing, because that is strictly mandated by Medicare and Medicaid rules. I know that, Russell, you have worked with AeroCare for a long, long time, and I know that they've been with you. You have a history with them, but you have not dealt with us here. We have 3 or more. We have air flight companies that are ready to respond. We have 3 solid, consistent, and we've been here over 15 years, and we have worked with MCH through a lot of turmoil and a lot of past conflict. And we've worked with you, I mean, not with you, but with MCHS. And we would like to continue that, and we're only asking the board to table this item so that you can review it a lot more than what's been presented. There's a lot more to this. And I know that we want to support Russell 100%. He's a real top man here. And I think that he will do a good job for us, but he needs to slow down. And I would all of you just table the item for now and look at our history and their history and look at what you're bringing to the table. There's no way to save that kind of money. You're breaking some type of federal law.
Okay, that's
because
3
we
minutes.
are, all our fees are
That's 3
regulated.
minutes, so give me just a second. I think that right now we need to swap computers. So everybody's gonna have to log back in. No? Oh, well, hang on just a minute. Everybody just hold on for a second. We're gonna swap computers. Give us a break. Just a second, please.
I see you, Jan.
Oh, no.
Hey, Shannon.
Hi, Jen.
Let's try.
Okay, is everybody there with us? Hang on, let's get this one turned off. Okay, now Everybody there with us?
Yeah, looks like it worked.
Okay, so, Carol, I'm sorry that this has kind of been so crazy, but it's new to us too.
I understand.
We have had a lot of discussion already on this. You made a comment and said less money. And from what I understand, your rates are more than Medicare rates and more than what we're talking about from this new company, and that your rates are not consistent. What is your rate?
No, I will beg to differ that, and that's the chance that we have not gotten because we do not have a contract.
Ma'am, I'm asking a question on what your rate is.
Right now, I am not the manager for my company. I can tell you that we do Medicare and Medicaid rates for the hospital.
Okay,
because
okay,
we're mandated.
Hang on, Carol, this is a debate. We're asking questions, so hang on with me.
I'm telling you that whatever the Medicare rate is, whatever the Medicaid.
That's not what they're showing us. I'm asking questions that I've got paperwork on that saying that that's not true. But hang on, I've got more questions. So the biggest issue that I have is leaving patients here waiting on a guarantee from the hospital, from the taxpayers of Ector County, to take a patient on a run. And in my opinion, you're in a medical business, and you bill insurance companies. Why do we need to guarantee you, and why would we need to stay with you when another company is willing to do their own billing?
We do our own billing, sir. That's why I'm asking you to table this so you can get all the details and all of the facts to your questions. You do not have the proper information.
So you're telling me you haven't left patients in the ER waiting on a guarantee.
We have never turned down a run from MCHS. I can guarantee you that. We have maybe waited on paperwork. Yes, we might have waited because Medicaid used to require a fax paper before we could even transport a Medicaid patient. Things like that do happen, but we have never, in all of my knowledge, my company has never turned down a run from MCHS. And
Okay.
we have written off.
Okay, Carol, we've got a lot of questions to get through, so just hang with us. We're going to have to just answer the question and go forward. Anybody else have any questions they want to ask?
Yeah, I got a question. Now, my question is that we did go out for bids, correct?
Everybody got sent an RFQ.
That's correct.
Is that correct?
Yes,
so we did go out for RFPs, right?
Yes, sir.
And then everybody submitted their RFPs.
Yes, sir.
Then what is the debate? I understand we want to stay local, and I've gone through, we've had this discussion, I guess, last week or last month. I don't think, it's like anything that we do, and this is, discussing this with you, Carol, is once those RFPs go out, I believe that the CEO of the hospital should be allowed to make what's going to be the best for the patient and the county and for the board cost-wise. And as much as I want to stay local, if we're losing money to local companies who have to have some guarantees, we got to do what's best for the taxpayers.
Okay. Anybody else got anything they want to say on it? Any of the board members have anything else they want to say?
Yeah, Don, this is Wallace Dunn.
Go ahead, Wallace.
Yeah, I want to say, your comments at the beginning of this that it's not a new company, but everybody keeps talking about local, and we are going to continue calling local ambulance providers. If the agreement that we make with AMR, if we need additional ambulance, we are still going to call the local providers. And I totally disagree with tabling this measure. We've discussed it very fully as a board. I feel 100% comfortable that we are making the right decision for our patients and the community, and more importantly, for the hospital. So I am not in favor of tabling the agenda item.
I agree. Any other board members have anything to say?
Dawn, this is Bryn. I would like to address the financial piece of this. When I was elected 3 years ago, I made a promise to this community that I would enforce accountability and we would be fiscally responsible. And I have to be very blunt and honest. And until Mr. Ewing and Mr. Tippin have been in the seats that they are, I haven't felt the way that I do and as comfortable that I do with anyone in that facility managing the financial piece. And I trust that Mr. Ewing has reviewed this thoroughly, and it is financially the responsible thing for our institute to do at this point. We are having to make huge cuts, and we're cutting contracts that we don't want to cut. We're having to make difficult decisions, and it is not easy. And I think every one of us, if we could, we would continue to work with any of the local agencies, and I know we will, but we have to do what is fiscally responsible for our entity and protect the taxpayer dollar. That's what we promised as a board to do, and we will do that. And I support Mr. Tippin and Mr. Ewing's decision on that, and I hope that the local companies continue to support the medical center.
Thank you, Bryn.
I
Any
would
other
like
board
to
members?
say on behalf of the three companies, let's say thank you.
Ma'am, you're not in order to talk right now. We've heard from you. This is my show. I'm sorry, but we've got an agenda. Any other board members have anything they'd like to say?
I just had a question. How long is this contract that we're about to commit to?
The contract would be 3 years with a 90-day out.
And do the other companies have an opportunity to approach medical center at a later date, showing, I guess, some progress or whatnot, and renegotiate possibly?
Yes, sir.
That's all I had.
Anybody in this room would like to say anything? Russell?
I recommend to this board that we approve the AMR contract, and I would send that to the board for approval.
I'm asking for a motion and a second, please.
I will make the motion. This is Wallace Dunn.
This is Richard Herrera. I second it.
Who seconded?
Richard
Okay.
Wallace made a motion. Richard second. I'm going to have a roll call vote. Bryn Dodd.
Aye.
David Dunn.
Aye.
Don Hallmark's an aye. Ben Quiros.
Aye.
Richard.
Richard Herrera's an aye.
Mary Lou.
Aye.
Wallace.
Mary Lou.
Wallace is aye.
Okay. That is carried. Motion's carried. Next, we have the COVID-19 update.
On the COVID-19, I'm sure most of y'all, we all speak pretty frequently about this, but just to give you a brief update on our current situation, we currently have 4 patients in-house positive. We've had a total of 56 positive. We've tested almost 800 folks through medical center. We only have 14 of those pending. So that is moving at a very good clip. Our rapid test, the 45-minute test, we've been using those to make sure people who are suspect of the COVID, we are testing them. And so we're able to keep our suspected cases to 0 or 1 because we're able to determine within 45 minutes if they're positive or not. So that's been very good for us. If you remember when all this first started, we were anticipating the data was showing us to have a wave of 300, if not more, positive COVID patients. So far, we have admitted 15 positives to the hospital. So you can see that we're blessed. I think our geographical isolation has worked to our advantage here. That's kept us from blowing this up. Again, things can change with the world opening back up and social distancing shrinking. We are moving into a stage of being ready for a second possible wave. I will tell you the work that our staff has done from top to bottom has been nothing less than heroic. These nurses and housekeepers and lab techs and doctors putting their families and themselves at risk by being able to go out and be on the front line with these COVID positive cases. Besides wearing a cape, that's the only thing from them being labeled a hero. But at the same time, we have learned a lot from this. The sacrifices that we've had to make as far as deciding what staffing levels to keep, what contracts to keep, has been very difficult, remains difficult. Between staffing and reducing hours and furloughing employees, we have put the stress on our crew, and they have performed just unbelievable. I'd like to tell you that all that is over and we've reached our goal for our first set of accomplishments that Steve rolled out to us and that our E-team rolled down to the directors. That mission has been accomplished. Correct. We have seen probably a 20%, 25% reduction in our payroll. You'll see that started reflecting next month, but we have to be mindful as the more this continues, the more difficult choices we'll have to consider. Again, nobody would ever thought in the world's worst health crisis that hospitals would be under such financial pressure. We're not different than anybody else. I can tell you our partnerships with the region remain very strong, and I could just ramble on, but I can tell you Medical Center has been the leader in this from the get-go. If you remember, our first meeting was March the 2nd. That was only 90 days, not 60 days. 60 days ago, and it seems a lot longer than that when that took place. But a lot has happened in there. But I want to tell you, you need to be proud of your hospital and what is accomplished. You need to pray for us and the staff that we've had to reduce their hours or furlough them. Please pray for them and their families as we continue to move on. But I want to tell you from your CEO spot, y'all are making my job very easy, if there is such a thing, with your support, your kindness, your calls and texts of support to me and to this staff are much appreciated. And I'll save the rest of my comments for executive session, but thank you very much for what you've allowed us to do to cope with this emergency.
And then next we have ad hoc reports. Anything on that?
No, sir. I think that we're good with that.
Okay. Before we go in executive session, while we've got everybody on there, I want to just say that it has been an amazing thing to see all these people work up here. It's awesome to just get to be a part of it. But our CEO and our CNO and Matt and everybody has just been amazing, and I couldn't say enough. I'm glad to have a part, just to get to see it go. So we're going to go into executive session. Y'all have to log out and log back in.
Because I can't remove anybody with Kristen logged in. We've got to switch it back over to mine.
Yeah, so stand by. We'll take a quick break.
Yeah, they got to log back in, right?
Yeah.
Yeah. Okay. Board, you'll have to log back in. No.
Well, you gotta make sure you have true executive.
We're just going to remove everybody.
Oh,
We don't have a meeting notice to log back into.
Hang on, board. I'm wrong.
Yeah, just stand by.
That's the first time that's ever happened. I've never been wrong before.
All right, ready?
Lisa. Ooh. Hello?
Hello?
Hey, Brent.
Y'all just hang on. They're gonna come back.
Okay, good.
I gotta take a quick break.
Hello?
Why are we going? Oh, 35. I can turn it off. So we're still. Okay, that should be on down.
I'm not sure why it's like. Yeah, that's it. That's well. I'm just curious if it's still echoing, but I don't think so.
So Ben Brown, Mary, 1, 2, 3, 4, 5. Who did we lose?
You had a picture. You just had a picture.
David. We lost David.
Yes. That was fun, Jen.
Did she get okay now?
I mean, it says it's gonna restart and you couldn't send it and stuff like that.
What a crazy day. You sitting over there being so quiet about it.